Question 1. A pharmacy technician is preparing to compound a sterile intravenous admixture in a laminar airflow workbench, LAFW. Which of the following describes the minimum ISO classification required for the air within the LAFW itself? A. ISO Class 5. B. ISO Class 7. C. ISO Class 8. D. ISO Class 9. Answer: A. ISO Class 5. This question tests knowledge of environmental controls in sterile compounding, specifically the ISO classification for critical areas as outlined in USP less than 797. The keyword minimum ISO classification for the LAFW itself points to the highest air quality standard where sterile preparations are compounded. ISO Class 5, which allows for very few particles per cubic foot of air, is the required standard within the LAFW to ensure the cleanest environment directly around the sterile compounding process and prevent microbial contamination. For instance, if a technician is preparing a chemotherapy infusion, the area inside the hood must meet the strict ISO 5 standard. Always remember that the smaller the ISO class number, the cleaner the air. Question 2. A prescription is received for ceftonir 250 mg per 5 ml, 150 ml, with directions to administer 7 mg per kilogram per day divided every 12 hours for a child weighing 44 pounds. What is the total volume, in milliliters, the patient should receive per dose? A. 3.5 milliliters. B. 7.0 milliliters. C. 14.0 milliliters. D. 21.0 milliliters. Answer: B. 7.0 milliliters. This calculation question requires multiple steps, including weight conversion, total daily dose calculation, and then converting the dose into a volume per administration. First, convert the child's weight from pounds to kilograms. 44 pounds / 2.2 pounds per kilogram equals 20 kilograms. Next, calculate the total daily dose, 7 milligrams per kilogram per day * 20 kilograms equals 140 milligrams per day. Since the dose is divided every 12 hours, this means 2 doses per day, so each dose is 70 milligrams, 140 milligrams per day / 2 doses / day. Finally, use the concentration of the medication, 250 mg per 5 ml, to find the volume per dose, 70 mg / 250 mg, *5 ml equals 1.4 ml *5 is equal to 7.0 ml. Mastering these multi-step calculations is crucial, as they are common on the ExCPT exam. Question 3. A patient presents to the pharmacy with a prescription for a Schedule II controlled substance, written on a standard prescription pad. The prescription lacks the prescriber's DEA number. What action should the pharmacy technician take? A. Fill the prescription as written and obtain the DEA number later. B. Contact the prescriber to obtain the missing DEA number. C. Dispense a 3-day supply and request a new prescription. D. Inform the patient that the prescription cannot be filled under any circumstances. Answer: B. Contact the prescriber to obtain the missing DEA number. This question tests knowledge of controlled substance regulations and prescription requirements, particularly for Schedule II drugs. The keyword Schedule II controlled substance immediately signals strict legal requirements. A prescriber's DEA number is a mandatory element for all controlled substance prescriptions, and its absence renders the prescription invalid for dispensing. The pharmacy technician should contact the prescriber's office to obtain the missing information, which can then be added to the prescription to make it legally complete. For example, if a patient brings in a Vicodin prescription without a DEA number, the technician must verify it with the doctor's office before dispensing. Always remember that controlled substance prescriptions must be complete and accurate before dispensing to ensure legal compliance and patient safety. Question 4. Which of the following auxiliary labels would be most appropriate for a prescription of metronidazole oral tablets? A. May cause drowsiness. B. Take with food. C. Avoid alcohol. D. Take on an empty stomach. Answer: C. Avoid alcohol. This question assesses knowledge of specific drug interactions and appropriate patient counseling points via auxiliary labels. Metronidazole, an antibiotic, is notorious for causing a disulfiram-like reaction when consumed with alcohol, leading to symptoms like severe nausea, vomiting, abdominal cramps, and headaches. Therefore, avoid alcohol is the most crucial auxiliary label to apply. For instance, a patient taking metronidazole for a bacterial infection must be explicitly warned against consuming alcoholic beverages or products containing alcohol, such as some mouthwashes. Always double-check drug-specific warnings to ensure patients receive the most critical safety information. Question 5. A pharmacy receives a recall notice for a specific lot number of an injectable medication due to a manufacturing defect. This recall is classified as a Class 1 recall. What is the most immediate action the pharmacy technician should take? A. Remove the product from shelves and hold for return. B. Continue dispensing the product but monitor patients closely. C. Notify all patients who received the recalled lot number. D. Dispose of the recalled product immediately in hazardous waste. Answer: A. Remove the product from shelves and hold for return. This question focuses on understanding drug recalls and their classifications, specifically the urgent actions required for a Class 1 recall. A Class 1 recall indicates that there is a reasonable probability that using or being exposed to the product will cause serious adverse health consequences or death, making immediate action critical. The most immediate and appropriate action is to physically remove the affected product from all dispensing and storage areas to prevent it from reaching patients, and then quarantine it for return to the manufacturer or wholesaler. Notifying patients is important but comes after securing the product. For example, if a batch of insulin is recalled due to potential potency issues, the first step is to pull all affected vials from stock. Always prioritize patient safety by immediately isolating recalled products. Question 6. A patient presents a prescription for a brand name medication that is not covered by their insurance formulary. The insurance plan requires the patient to try a generic alternative or a similar preferred drug first before covering the prescribed medication. This is an example of what type of insurance restriction? A. Step therapy. B. Prior authorization. C. Quantity limit. D. Refill too soon. Answer: A. Step therapy. This question assesses understanding of common insurance restrictions that can impact medication access. Step therapy, also known as fail first, is a managed care strategy where patients must try and fail on a less expensive or preferred medication, the Step 1 drug, before the insurance company will cover a more expensive or non-preferred alternative. The clue lies in the requirement to try a generic alternative or a similar preferred drug first. For instance, if a doctor prescribes a new, expensive biologic, the insurance might require the patient to try a cheaper, older anti-inflammatory first. Recognizing these restrictions helps pharmacy technicians communicate effectively with patients and prescribers to resolve billing issues. Question 7. A pharmacy technician is reviewing a patient's profile and notices 2 prescriptions for the same medication from different prescribers, with overlapping dates. One is for lisinopril 10 mg daily, and the other is for lisinopril 20 mg daily. This situation most likely indicates which of the following? A. Patient non-adherence. B. Therapeutic duplication. C. Early refill. D. Adverse drug reaction. Answer: B. Therapeutic duplication. This question addresses a critical aspect of medication safety, identifying potential drug-related problems. Therapeutic duplication occurs when a patient is prescribed 2 or more medications that have the same or similar pharmacologic action, which can lead to excessive effects or increased risk of side effects. The key here is same medication from different prescribers, with overlapping dates and different strengths of the same medication, lisinopril, indicating the patient might be taking both, leading to an overdose. For example, if a patient receives 2 prescriptions for different strengths of a blood pressure medication, taking both could dangerously lower their blood pressure. Pharmacy technicians play a vital role in identifying and alerting the pharmacist to such issues to prevent harm. Question 8. A pharmacy technician is compounding a non-sterile oral liquid suspension from a commercially available tablet. According to USP less than 795 guidelines, what is the maximum beyond use date, BUD, for this preparation if stored at controlled room temperature? A. 14 days. B. 30 days. C. 6 months. D. The expiration date of the earliest expiring ingredient. Answer: A. 14 days. This question tests knowledge of beyond use dates, BUDs, for non-sterile compounded preparations, specifically according to USP less than 795. When compounding a non-aqueous formulation or an oral solid dosage form that is manufactured into a liquid, like crushing a tablet for suspension, the maximum beyond use date is typically 14 days when stored at controlled cold temperatures, or shorter if the manufacturer's product stability indicates less. The most common interpretation for an oral liquid suspension made from tablets is that if water is added, it becomes an aqueous solution/suspension, which then limits the BUD to no more than 14 days when refrigerated, or at room temperature if stability data supports it, usually still within 14 days for most suspensions. Given the options, 14 days is the most appropriate and conservative choice for an oral liquid made from a commercially available solid. This ensures patient safety by limiting the time the compounded product is used before potential degradation. Question 9. A prescription reads Humalog QuickPen 10 units subcutaneously TIDAC. Which of the following best describes when the patient should administer this medication? A. 3 times a day at bedtime. B. 3 times a day after meals. C. 3 times a day before meals. D. 2 times a day before meals. Answer: C. 3 times a day before meals. This question assesses the understanding of common medical abbreviations used in prescriptions. The key abbreviations are TID and AC. TID means 3 times a day, and AC is the Latin abbreviation for anticipum, meaning before meals. Therefore, the medication should be administered 3 times a day before meals. For example, if a patient has diabetes and needs insulin to manage blood sugar spikes from food, taking it before meals helps control that spike. Always verify any unclear abbreviations with the prescriber or pharmacist to prevent medication errors. Question 10. A pharmacy technician receives a bulk order of a controlled substance from a wholesaler. Which DEA form is typically used to document the transfer of Schedule II controlled substances between registrants? A. DEA Form 106. B. DEA Form 222. C. DEA Form 41. D. DEA Form 224. Answer: B. DEA Form 222. This question tests specific knowledge of DEA forms related to controlled substances. The critical clue is bulk order of a controlled substance and Schedule II controlled substances, which require strict accountability. DEA Form 222 is the official order form used by pharmacies to order Schedule II controlled substances from suppliers, and it documents the transfer of these highly controlled drugs. For instance, if a pharmacy needs to restock oxycodone, they must use a DA Form 222 to place the order with their wholesaler. Remember that specific DA forms are designated for very specific purposes to ensure proper tracking and prevent diversion of controlled substances. Question 11. A physician calls the pharmacy to change a patient's prescription from atorvastatin 20 mg daily to rosuvastatin 10 mg daily. The pharmacy technician should recognize that both medications belong to which drug class? A. ACE inhibitors. B. Beta blockers. C. Statins. D. Diuretics. Answer: C. Statins. This question requires knowledge of common drug classifications. Atorvastatin and rosuvastatin are both recognizable by their common statin suffix, which identifies them as HMG-CoA reductase inhibitors, commonly known as statins. This class of drugs is primarily used to lower cholesterol levels. For example, if a patient has high cholesterol, their doctor might prescribe either atorvastatin or rosuvastatin, as they both work in a similar way to reduce cholesterol production in the liver. Recognizing common drug class suffixes helps technicians identify therapeutic equivalencies and potential drug interactions. Question 12. A pharmacy technician is preparing a compounded sterile product that will be administered to a patient within 1 hour of preparation. According to USP less than 797 guidelines, this preparation would be considered A. Low-risk compounded sterile product. B. Medium-risk compounded sterile product. C. High-risk compounded sterile product. D. Immediate-use compounded sterile product. Answer: D. Immediate-use compounded sterile product. This question probes understanding of USP less than 797 risk levels and their corresponding beyond-use dates, BUDs. The key phrase "administered to a patient within 1 hour of preparation" directly points to the definition of an immediate-use compounded sterile product. These preparations are intended for rapid administration when delays would harm the patient and are exempt from certain complex compounding requirements, but they must be prepared under strict conditions and administered very quickly. An example would be a urgent dose of an antibiotic prepared in a clinic setting. Understanding these classifications is crucial for ensuring patient safety and compliance with sterile compounding regulations. Question 13. A patient returns unused medication to the pharmacy. Which of the following is the most appropriate action for the pharmacy technician to take regarding this returned medication? A. Accept the medication and return it to stock if it is unopened. B. Accept the medication and dispose of it immediately according to hazardous waste protocols. C. Inform the patient that the pharmacy cannot accept returned medications due to safety regulations. D. Accept the medication and transfer it to another patient in need. Answer: C. Inform the patient that the pharmacy cannot accept returned medications due to safety regulations. This question addresses pharmacy policy and legal regulations regarding returned medications, especially for patient safety and drug integrity. Most pharmacies, by law and best practice, cannot accept returned medications from patients once they have left the pharmacy's control, even if unopened. This is to prevent the possibility of contamination, improper storage, or tampering, which could compromise the drug's safety and efficacy. Patients should be advised to dispose of unused medications properly, often through take-back programs or specific disposal methods described by the FDA. This practice ensures the integrity of the drug supply and prevents potential harm to other patients. Question 14. A prescription calls for 1,000 milliliters of D5W to be infused over 8 hours. The 4-tubing delivers 15 drops/ml. What is the correct flow rate in drops per minute, GTTS/min? A. 31 GTTS/min. B. 39 GTTS/min. C. 47 GTTS/min. D. 52 GTTS/min? Answer A. 31 GTTS/min. This calculation question requires converting infusion time and volume into a drops per minute flow rate. First, convert the total infusion time from hours to minutes. 8 hours * 60 minutes/hour equals 480 minutes. Next, apply the formula for flow rate, volume in ml * drop factor in GTTS/ml/time in minutes. So, 1000 milliliters * 15 GTTS/ml/480 minutes equals 15,000 GTTS/480 minutes equals 31.25 GTTS/min. When calculating flow rates, always round to the nearest whole number since you cannot administer a fraction of a drop, making 31 GTTS/min the correct answer. Mastering these multi-step conversions is essential for medication administration calculations. Question 15. Which of the following conditions would contraindicate the use of isotretinoin, requiring specific counseling and monitoring by the pharmacy technician? A. Mild acne. B. Pregnancy. C. Elevated cholesterol. D. Dry skin. Answer B. Pregnancy. This question tests knowledge of severe contraindications and specific drug-related warnings. Isotretinoin is a powerful medication primarily used for severe acne, but it is a known teratogen, meaning it causes severe birth defects if taken during pregnancy. This risk is so high that specific programs like iPledge are in place to prevent pregnancy in patients taking this drug. Therefore, pregnancy is an absolute contraindication. For example, a female patient of childbearing potential prescribed isotretinoin must be enrolled in a risk management program and use 2 forms of birth control. Always be aware of medications with absolute contraindications, as they represent significant patient safety risks. Question 16. A patient asks the pharmacy technician for advice on choosing an over-the-counter, OTC, medication for persistent heartburn. The technician should A. Recommend the strongest antacid available. B. Direct the patient to the heartburn aisle and suggest reading labels. C. Advise the patient to consult with the pharmacist for a recommendation. D. Suggest a specific proton pump inhibitor based on personal experience. Answer C. Advise the patient to consult with the pharmacist for a recommendation. This question addresses the scope of practice for pharmacy technicians, particularly when it comes to patient counseling and making medication recommendations. Pharmacy technicians are not permitted to provide clinical advice or recommend specific medications, even for over-the-counter products. Such tasks fall under the professional judgment of a licensed pharmacist, who can assess the patient's full medical history and current medications to ensure a safe and effective recommendation. For instance, if a patient asks about a cough medicine for their child, the technician should always refer them to the pharmacist. Remember, your role is to support the pharmacist, not to offer medical advice. Question 17. A patient informs the pharmacy technician that they have been taking St. John's wort daily for depression. The technician notices the patient is also prescribed an oral contraceptive. What potential drug interaction should the technician be most concerned about and bring to the pharmacist's attention? A. Increased risk of sedation. B. Decreased effectiveness of the oral contraceptive. C. Increased risk of bleeding. D. Elevated blood pressure. Answer B. Decreased effectiveness of the oral contraceptive. This question assesses knowledge of significant drug-herb interactions. St. John's wort is a known enzyme inducer, meaning it can speed up the metabolism of many medications, including oral contraceptives. This accelerated metabolism can lead to decreased effectiveness of the oral contraceptive, potentially resulting in an unplanned pregnancy. For example, if a patient relies on birth control pills, Concurrent use of St. John's wort could render those pills ineffective, leading to a significant health consequence. Always be vigilant for potential interactions between herbal supplements and prescription medications, especially those with narrow therapeutic windows or critical functions like birth control. Question 18. A pharmacy technician is responsible for maintaining inventory. Which of the following inventory management methods automatically tracks product usage and triggers reorders when stock levels fall below a predetermined minimum? A. Manual perpetual inventory. B. Just-in-time (JIT) inventory. C. Point of sale (POS) system. D. ABC analysis. Answer: C. Point of sale (POS) system. This question focuses on inventory management systems used in pharmacies. A point of sale (POS) system is an electronic system that records each sale as it happens, automatically updating inventory counts and often triggering reorders when stock levels reach a predefined reorder point. This method provides real-time data on product usage and helps maintain optimal stock levels without constant manual checks. For instance, when a prescription for ibuprofen is scanned and sold, the POS system deducts it from the inventory count and can automatically generate a purchase order when stock is low. Understanding these systems is key to efficient pharmacy operations. Question 19. During a drug utilization review, DUR, the pharmacist identifies that a patient is prescribed both warfarin and a new prescription for sulfamethoxazole/trimethoprim, Bactrim. This combination significantly increases the risk of bleeding. What type of DUR alert is this? A. Overutilization. B. Underutilization. C. Drug-drug interaction. D. Therapeutic duplication. Answer: C. Drug-drug interaction. This question tests understanding of different types of drug utilization reviews, DURs, and common medication safety concerns. The scenario describes two medications, warfarin, an anticoagulant, or blood thinner, and sulfamethoxazole/trimethoprim, an antibiotic, whose combined use leads to a significantly increased risk of bleeding. This is a classic example of a drug-drug interaction, where one medication affects the action of another, leading to an adverse outcome. Identifying such interactions is a primary function of DURs, protecting patients from harmful effects. Always be aware that certain drug combinations can be dangerous and require pharmacist intervention. Question 20. A patient receives a prescription for clopidogrel. The pharmacy technician identifies this medication as belonging to which class of drugs? A. Antihypertensives. B. Antiplatelets. C. Anticoagulants. D. Diuretics. Answer: B. Antiplatelets. This question requires knowledge of specific drug classifications. Clopidogrel is a commonly prescribed medication that works by preventing platelets from sticking together and forming clots, thus classifying it as an antiplatelet drug. While both antiplatelets and anticoagulants affect blood clotting, they do so through different mechanisms, and it is important to distinguish between them. For example, a patient who has had a heart attack or stroke might be prescribed clopidogrel to prevent future clot formation. Understanding drug classes is fundamental for recognizing drug indications and potential interactions. Question 21. A pharmacy technician is preparing a controlled substance for dispensing. Before placing the prescription in the dispensing bin, the technician must ensure the label includes the federal legend, "Caution, federal law prohibits transfer of this drug to any person other than the patient for whom it was prescribed." This legend is required for which schedule of controlled substances? A. Schedule 1. B. Schedule 2. C. Schedule 3, 4, and V. D. All controlled substances, Schedule 1V. Answer: C. Schedule 3, 4, and V. This question tests specific knowledge of labeling requirements for controlled substances as per federal law. The federal legend about transfer prohibition is specifically required on the labels of Schedule 3, 4, and V controlled substances. Schedule 2 medications have a similar but not identical transfer warning. This labeling requirement helps to prevent the diversion and misuse of less stringently controlled substances once they are dispensed to the patient. For example, a prescription bottle of a Schedule 4 benzodiazepine like lorazepam must prominently display this warning. Pay close attention to the nuanced differences in regulations for each controlled substance schedule. Question 22. A patient calls the pharmacy asking for the phone number of their physician, stating they forgot it. The pharmacy technician should A. Provide the phone number directly to the patient. B. Politely decline, citing patient privacy, HIPAA, regulations. C. Offer to call the physician's office on behalf of the patient. D. Ask the patient for their date of birth and then provide the number. Answer: A. Provide the phone number directly to the patient. This question assesses understanding of HIPAA and patient privacy in a common pharmacy scenario. HIPAA protects protected health information, PHI, which includes medical records and patient-specific health details, but a physician's office phone number is publicly available information, not confidential patient health data. Therefore, providing the phone number to the patient does not violate HIPAA. For instance, if a patient asks for their doctor's contact information, it is generally considered a helpful service that can be provided without concern for privacy breaches. Always distinguish between publicly available information and protected health information. Question 23. A pharmacy technician is required to assist in ordering narcotics. What is the maximum number of items, different drugs and strengths, that can be ordered on a single DA Form 222? A. 5. B. 7. C. 10. D. 20. Answer: C. 10. This question tests a very specific detail about the DA Form 222, which is critical for ordering Schedule 2 controlled substances. Each line on a DA Form 222 is designated for a single item, and there are exactly 10 lines on the form. Therefore, a maximum of 10 different items, each unique drug, strength, and dosage form, can be ordered on one DA Form 222. For example, if a pharmacy needs to order oxycodone tablets 5 mg, oxycodone tablets 10 mg, and morphine solution, these would count as 3 separate items on the form. Paying attention to such procedural details is important for regulatory compliance. Question 24. Which of the following conditions is most likely to be treated with a statin medication? A. Asthma. B. Hypertension. C. Hyperlipidemia. D. Diabetes mellitus. Answer: C. Hyperlipidemia. This question directly tests the primary indication for a common drug class. Statins are a class of drugs, like atorvastatin or simvastatin, specifically prescribed to lower elevated levels of lipids, fats, in the blood, a condition known as hyperlipidemia or high cholesterol. While high cholesterol can contribute to other conditions listed, the primary therapeutic target of statins is lipid reduction. For instance, a patient with high LDL, bad, cholesterol would typically be prescribed a statin to help reduce their risk of heart disease. Understanding the main uses of drug classes is fundamental to pharmacy practice. Question 25. A prescriber writes a prescription for azithromycin 250 mg number 6, Sig. Take 2 tabs on day 1, then 1 tab daily for 4 days. How many milligrams of azithromycin will the patient take on the first day? A. 250 milligrams. B. 500 milligrams. C. 750 milligrams. D. 1000 milligrams. Answer B. 500 milligrams. This calculation question requires careful interpretation of the dosage instructions. The prescription states, take 2 tabs on day 1. Since each tablet contains 250 milligrams of azithromycin, the patient will take 2 tablets * 250 milligrams per tablet equals 500 milligrams on the first day. This is a common dosing regimen for azithromycin to achieve a loading dose, and accurately calculating the initial dose is critical for patient safety. Always pay close attention to the specific instructions for each day of therapy, especially when a loading dose is involved.